Hello, good morning, everybody. Welcome along to this Growth Hub webinar. My name is Joseph Midgley. I work for the Growth Hub. I think I've met many of you in face-to-face at various points looking at the names. Just before I hand over to Rachel Barber from Living for Moments, who's going to be delivering the main session, I'll just say a few quick words. As you'll all no doubt be aware, this is I'm from the Growth Hub. This is a Growth Hub webinar. You'll have been on our website to sign up. We are doing loads of various business support programs at the moment, including webinars. I'll be putting some links in the chat as we go along, so please do keep an eye out for that, some further content. Today's webinar is around inclusion training. Now, on the slide, you'll see that it's primarily aimed at hospitality and retail businesses, but especially as this is an introductory session, it's kind of quite wide and shallow, so it'll be very relevant for a lot of different businesses, and it's just aimed at kind of different ways that inclusion can be beneficial to your businesses as well as to your customers and your staff. I'll let Rachel get into the detail of that. Quick bit of housekeeping. This session is being recorded and we'll share the slide deck out by email along with that recording afterwards. So if there's anything you miss, or if you think this is absolutely amazing content, I need to share it with other people, that'll come out by email and you can pass that on. I'll post some links in the chat as we go. If you've got any questions, please do put them in the chat. We're a relatively small group and it's intended to be an interactive session. So if you've got a question, feel free to put your hand up and say it out loud. Just be aware that that'll be on the recording. If you'd like to ask a question but not say it out loud, stick it in the chat and I'm happy to say that to Rachel. If it's relevant to the slide we're on at the time, we'll do it as we go. If not, we'll have some time for some questions at the end. And I think Rachel's got some kind of interactive bits planned as well. On that note, if you do want to put your cameras on, that's really appreciated. I think it's always beneficial for the speaker if you can see who she's speaking to. So I would encourage you to put your cameras on, but no worries if not. I think that's just about enough waffling for me. As I say, any questions, keep an eye on the chat. And if you need any support, I'll be keeping an eye on that. So feel free to ask any questions as we go. Over to you, Rachel.
Okay, good. Thank you, Joseph, and good morning to everyone. So today's session is very broad and it is aimed at hospitality, but it's relevant to any business. I've worked with many businesses on how to make them inclusive through training, audits, and also through talks. And I'm profoundly deaf, so when you do speak, it would be really helpful to be able to see your faces. So I will ask you to put the camera on when you ask a question. Do use the chat box as well. Just to make you aware that we do have captions on this. So if you need them, just press on the CC button. Okay. So we'll crack on then. So the next slide, please. So just a few ground rules, just really quick. Respect, confidentiality, listen, and share experiences without names. If you do use name, first name is absolutely fine. Engage and repeat when asked. Microphones off when not speaking, and keep mobiles off if needed for emergencies on silence. So I'm not going to dwell on these ground rules, but shall we move on quickly then? So we said it's interactive, and I'm going to start right now. So if you can go, oh, sorry, before I do that, just cover the objectives. So introduction, disability awareness training, why it actually matters. Now, this actually will be covered in more detail in the training that we'll be delivering in the new year, and how small changes can make a significant difference is something to customer loyalty and employee retainment. A lot of employees leave when they develop a change of circumstances, whether that's a new health condition or a new disability. Legislation, I'll cover this very, very briefly today. And finally, not least, the Purple Pound, which is one of the really big incentive for you to work with disabled people. Because the Purple Pound calculations are staggering high. This is an easy way for you to make money, which currently has been lost to a lot of businesses. And we'll go into more details on that, definitely in the training. Okay, next slide. Right, so we are going to get you to do a little bit of work. I want you to write or draw what's your first image when somebody says they have a disability or they're disabled. What's the first thing that you think of? I want you to draw and put in the chat box. So just to give you a minute or two to put in a chat box what your first. Any volunteers? Oh, you're just like, and you won't be, look, I'm really used to hearing any response, so please do feel free to put down. Don't be afraid. I won't bark at you in any way. This is a safe environment to really explore what your first thoughts are. Barriers, yeah. Okay. So any further? Okay, there are many accessibility challenges that there are not one that fits all. That's absolutely, yeah. That's okay. Don't worry about typos. Yeah. Okay. So what if I may ask the question slightly differently, what image do you see when somebody says they're disabled? Not in a physical manner, because as can be thought of in the past. So you're aware of the other non-physical. Okay, that's great. Any others? Okay. Yeah. Wheelchair is often the first image that people come up with. But that, as you say, it's not right, but that actually is the first image a lot of people come up with. And that's no coincidence. And that's because of what we see, the images in when we go around parking, for example, you'll have a wheelchair sign. And if any businesses say they're disabled friendly, they will often put wheelchair and not anything else. So it's not surprising that people put wheelchair is a first image. Now, as you all know, many disabilities are invisible or hidden, whichever word you want to use. And we will explore that more in the training. But it is important that we understand our perceptions because it does actually influence the way we behave. And that's why we will be exploring this in more detail. So I'll just go on to the next slide. And I want you to think about whether the word disability came up positively or negatively. Now, suspect, if you haven't, I'll give you a few negative, yeah? Yeah, okay. So why do you think we get a negative perception? What do you think in terms of negative? Why do you think we're getting that negative perception of people with disabilities? I'll just give you a few. A worry that they cannot cater for their needs, yeah? Okay. So that you're frightened that you're of doing the right thing. Okay. Anything else? Okay. So we get based on sympathy, which isn't helpful. So we don't want the pity, sympathy, absolutely. So why the way we behave, as I said, is influenced by what we've been immersing in terms of the images that we see around buildings, but we're also influenced by the media. Now, if you think about the media and stories, they tend to be very, very simplified. Either we're scroungers, we're ripping off the benefit system, it's one image that we portray, or we are a burden, hard to work with. Those sort of stories come up a lot. And we also get what we call the Paralympic inspirational stories. We don't really get much in between. We don't get the breadth of non-disabled people that we all actually have strengths and weaknesses. We're all individual. We have different interests, different skills. So it's very simplified. And as a result, they tend to be a division of non-disabled and disabled. And disabled tend to get lumped together, which erasing the individual identity that we all have. And that's really important for us to understand in terms of why we behave in the way we do, because some people don't want to work with disabled people because they have this ingrained from the media and story that it's not worth working with us. And this is really sad to see because that means disabled people are less likely to be employed, but also as customers, they're likely to be treated differently. And you are losing out a lot of potential customers when you treat people differently. So all of this does have an impact on different behaviours. And obviously we'll explore this in more detail in the training, but this is just to get you aware of how we behave, why we behave in the way we do. I didn't look at how did the words feel. I got the sense that they're saying it would be negative. Did you find any words harder than others in terms of a disabled word? No? Okay, so that's fine. We'll move on to the next slide then. Okay. So just a few stats to get you started. So the figure of disabled people is actually going up. It's now 24%, and this is a conservative figure because there will be a lot of people who don't register as disabled or don't see themselves as disabled. So it's actually much higher than that. So for example, in the deaf and hearing community, originally it was 12 million, now it's 18 million. So that's 1 in 3 people out of a population of 67 million. So we got a 66 million, I think, the population. So yeah, so it's 1 in 3. So you can see that figure, again, is actually quite conservative. Less than 8% of a disabled community use a wheelchair. So, you know, we go back to that image that wheelchairs are for a disability that we think of when we come up with an image of disabled people. It's less than 8%. Having said that, there is a large number of people who have a mobility component. So in other words, they may need to be parked nearby because they have they may have a chronic illness, which means they can't walk so far, or they may have accessories with walking sticks or whatever it may be. So mobility is a big part of a disabled community, but it's not necessarily wheelchair. The other thing I want to share is that 2% of the working age population become disabled every year. Now, this is really important because a lot of employers are losing really talented and skilled employees when they become disabled. Now, going through any change is hard enough, but when employers are not supportive, that makes it really, really bad. And as a result, most people just leave. And that's a huge expense, and it's also a real shame because you're losing skills. 78% of disabled people acquire their disability as over the age of 16. So this is just a reminder that any one of us can become disabled at any one time. We're only a step away. So it's hard enough experiencing a change of health or becoming disabled without having society treat us so differently. And that's, for many people, that's a huge shock. Is the way we are treated, which is the hardest thing to deal with. Okay, so those just a reminder of the stats. I'm just going to show the image on the next page, next slide, and you'll see this is how our perception can even influence a language. So how do you think this image went down and the words on it? Any thoughts on that? Do you think sales would improve with that? So this image was released 3 years ago from Boots. Now, there was absolute outrage on this image because the image itself is fine, but it's the words they've used: less able parking. Yeah, less equals not enough. So this is going back to what I was talking about earlier. Our perceptions influence the way we behave, including our language. So clearly the person who wrote this thought it was fine. But not only that, what's really concerning is that this would have been signed off at a very high level. And to get signed off shows that there was a complete lack of awareness that language was acceptable. And so it also suggests that they don't have a diverse workforce, or maybe it's not a safe environment for people to say that they think that's the wrong sign. So we talk about psychological safety in our training quite a bit, and we don't know what the cause was, but it could be either because people didn't feel safe to say that sign was inappropriate, or they lacked diversity in their workforce. It's one of those two. Okay, so talking of language, I do want to stress that some people say language is the thing that they fear most when they when they work with disabled people and also serving customers. They're really frightened about having the wrong and using the wrong language. One thing I would like to make reassure is that we rather you work with us or talk to us and engage with us and get the language wrong, because after all, we all make mistakes. I make mistakes still with some of the disabled community when I'm less familiar with. So it's really, really important that we just respond to individuals as they are, see the person first, the second disability. And if you get the language wrong, say, how can I help and what can I learn from this? So don't be defensive. Don't say, oh, I really didn't mean that. Use it as an opportunity to learn, because that would be fine. But at the end of the day, we want you to work with us, and your actions are also really key. So for customer services, some of the thing that is very common from people I've worked with is that I mentioned we are treated differently. So I come across some people who are blind or cerebral palsy who had ordered a drink and they were given an alcoholic drink and they were given a non-alcoholic drink. Would you do that with any other customer? No. So why is that happening? So this is the sort of thing going back to perception, but also this tendency to see disabled people, oh, they can't take the risk that every one of us takes every single day. And our choices are being eroded when you do that. So that's one thing. So that one action says a lot. By giving somebody something different. Another action, which is quite common in customer services, is when you're having a disabled person come in, whether in a wheelchair or cerebral palsy or somebody like myself who's deaf, and they come with a companion, and the person the person talking to you is the disabled person, and instead of replying to the disabled person, replying to somebody who's their companion. That is extremely rude. So please don't do that. So that just one of a simple thing. Just make sure you talk to the person talking to you, because that's what we do with everybody else. So let's do that. So what I'm saying is language is only one part. It's your actions as well that says a lot. So you need to explore your prejudices. You need to explore where your behaviors are coming from. Okay. So we'll go down to the next slide. So as I went through that, the thing about the impact on sales, the sales plummeted quite significantly with that. For that period of time, they took it down quite quickly, but the damage was still done. I'm not sure on the percentage, but the sales, I think it was around 35%, something around that plummeted during that time, during that uproar, the signage. Okay, so next slide. Okay. So perception, just exploring perceptions a bit more. Now, I've already told you I'm profoundly deaf. So I often get people coming up to me and doing sign language. Now, so they immediately assume that's my main language. So one of the things that we need to be careful of with any one of us is we don't make assumptions. And we need to work with the individual on what works for them. So communication is two-way. So if you see someone talking, don't respond in sign language. Now, I understand that sign language is, you get such a rare opportunity to practice it. Now, I'm actually learning BSL at the moment, and I know what it feels like. You learn the language and then you never get a chance to use it. So I think sometimes it's enthusiasm for actually using their BSL on anyone that they think they can have a chance on. But nevertheless, you do need to be careful. I mean, thank you and please, you just about get away with, but just be careful on that one, okay? Also, this comes back to employment. I know this is not employment focused, but it does mean that I get quite a lot of assumption, oh, I can't use a phone or I can't use certain technology just because I'm profoundly deaf. Now, technology has moved wonderfully fast. So I'm actually able to use a phone for the first time in many years because all my calls are captioned. So don't assume somebody who's profoundly deaf cannot use a phone. I do use a phone now. Having said that, captions are not accurate enough for me to do professional calls on a phone. So I tend to use it only with family and friends or people who I know, employees who I know would be understand that it's okay that I mishear a certain word or two. Okay. But just going back, don't make assumptions is the key thing there, because that's what holds us back. And it also influences the way you behave as well. Okay, so we're going to look at actions that actually can win customers over. Okay, so next slide, Joseph, thank you. Okay, so we got the actions, brilliant, that's fine. So actions, so the key thing in hospitality, and this is true not just in hospitality, is to make sure that information is clear in multiple formats. So if you're in a restaurant and you had a menu, for example, you wouldn't just have a written menu. You would have opportunities for people to have it in bigger print. You could possibly even have an audible menu, or you might just have waiter or waitress talk through the menu, which is perfectly acceptable. If you see someone struggling with the menu and say, "Can I help you with the menu?" and if they say yes, then you can say, "Well, I can talk through the menu if that would be useful." So those are the sort of things you could do. Warmth and friendliness is key. As in any customer service, you need to be warm and friendly to people. A smile goes a long way. So I went to a session a few weeks ago where people were really, and that dampens the mood straight away. So do smile because it makes a big difference. Proactive change that makes people feel welcome. So, for example, there was a lovely cafe that I visited a few months ago where we had people had been trained to communicate in different way. So we had some Makaton, we had some British Sign Language, and spoken English, obviously, but it was really nice that they were able to talk in different ways depending on who came in. As a result of that, they attracted more deaf clients, and it became a sort of hub. And as a result, it was really nice because it not only helped the cafe increase their revenue, but also it wasn't actually as noisy because there was a lot of people signing. So actually the noise level was quite good. So it was a sort of a hum, but it wasn't really loud. So for me, it was quite nice. Responsiveness to any concerns raised. Do be prompt with this, with any complaints or any suggestion. We need to also be aware of our challenge. Any colleagues or if you're in a cafe and somebody's been refused entry, you do need to be not a bystander. You need to say, no, that's not acceptable. So, for example, recently we had in the news, I think some of you will be familiar, we had somebody denied access into a restaurant because he had a guide dog. It is against the law to do that, but we need more people to say, no, you cannot do this. This is breaching the Equality Act, and he has every right to bring a dog into a restaurant because that is a tool, just like a wheelchair. You wouldn't deny somebody in a wheelchair into the restaurant. The same applies for somebody with a guide dog. So we need to be responsive. Small changes. Well, I'm going to share one really key change that has impacted on a lot of people. And I'm really surprised how wide this particular change I'm going to talk about now, which is on the next slide, is noise. Now, most venues you go to nowadays, from shops to restaurants to cafes, have music really, really loud. And many people have come up to me from these groups of people which I've listed on the slide, that it's really uncomfortable for them or it puts them off and they won't go back. So in the UK, they have 1.3 million people living with brain injury. And some of the people I've met who with brain injury say noise is really uncomfortable. But for some, it could trigger other conditions. So, for example, epileptic fits can happen if it's a noisy restaurant and noisy noise, loud music. There are 700,000 people living with autism. And autism find quite often they wear cancellation earphones, but actually that's not that helpful. They wouldn't need them so much if there are more sites which don't have loud music on all the time. There are nearly 1 million people living with dementia. Now, I work a lot with people who live in dementia, and dementia is confusing enough without having loud noise. So that they get put off, so they all walk away when it's really loud. People with auditory processing disorder will find it hard enough to concentrate and listen to a conversation without having loud music played. And as mentioned earlier, 18 million people, deaf and hard of hearing people. Now, the range on that deaf and hard of hearing issue from mild to profound, and mild to moderate with modern technology and hearing aids are pretty good at cancelling background noise, but even so, you're still making them work harder. And finally, not least, even non-disabled people benefit from having the music toned down, because increasing evidence that people exposed to live music persistently are at risk of developing a hearing loss and also tinnitus, which is really unpleasant, a continuous ringing in the ear or a noise that it never goes away. And that is something that is increased risk if you're exposed to loud noise on a continuous basis. So noise is just one example among many on how you can make things better. So I'm now going to leave you to do a little exercise. And because we're a small group, what I'm going to do is we can do it on the floor here, and we can do a chat box, and we can do it verbally. One activity, one action that you've taken, or possibly if you haven't taken, one action you think you would take, which could impact. So if you go on to the next slide, Joseph, that'd be brilliant. So I want you to think of small actions, but the key to the discussion are: how did it help? How did it, and who did it help? And what learning can you share from the example shared? So, and as I said, if you haven't got an example of an action that you've done, maybe think about an action that you think could help and who it would help. Okay, so I'll give you 5 minutes to think about this. So you can put it in the chat box, you can talk about it now, or would you like me to would you like us to put you into breakout room, the 5 of you? So which is your preference? Chat box or go into a breakout room? Okay. So you're thinking of your response. Okay, so you're happy with either. So why don't we just give you a few minutes for you to think about that, and then we can maybe come back to the floor and talk it through. Okay, so I'll give you 5 minutes. That's a really good example, Loom. I haven't come across that of software before, but thank you for sharing that. That's really good. So, and working with other support groups that helped us with our team, for example, Down Syndrome Society, brilliant, thank you. And large print, easy read style. This is past. Doing this verbally quite complicated and get confused with all the options, yeah. Okay. So you got some good suggestions there. And do you think they just help people who you targeted at? Who else do you think it might help? So Loom, who would that help? Yeah, our teams, yeah. Yeah, your team's definitely for the Down syndrome, absolutely. Working with other support groups is brilliant. And the Loom, sorry, who was that? David, could you just go through that a bit more detail? Because I haven't come across that software before. So how does it work?
Yeah, can you hear me okay?
Yeah. Yes, I can.
So effectively, it's like sending a YouTube video inside your email. And I believe at Loom's end, or at the recipient's end, once they view it, they can turn on subtitles, so to speak. And so AI will do something in the background, and it will sum up the messages, what you've sent to them. So it might just be a really brief thing. It might be 30 seconds that you're just going, yes, thank you for your email. And you could do sign language on that. You could do Makaton. You could just be speaking clearly into the microphone, and that person at the other end can receive that video with subtitles if they want, so they can see that email. The difficulty we've had is because key is the details, and if we send an email out, we can search for that email and find when we spoke about that, but you can't search for something that was mentioned in a video. And so it's really hard to roll that out so that is an option, but we've still got that option if someone needs it in the background. It's just not as easy to blanket across the whole organization.
Ah, okay. Well, thank you. That sounds really interesting. I'm just going to have to shut this curtain, but I'm getting the lovely sun on me.
But it's a good software to use because you can use it. You can start using it for free at a very modest level, and then it ramps up, and you have to start paying. But it is really useful for what we've found so far.
Brilliant. I'm going to have to look at that. So thank you so much for sharing that. That's Loom. So that's something for me to explore later. And it's something that hopefully will be easier to roll out. So that'd be brilliant. So thank you for sharing that example. So that would benefit many people, as you said, sign language and Makaton. So yeah, that's brilliant. So thank you for sharing that. Joe, you shared about large print and easy read. So that's great. So that doesn't just apply for people with learning disability. It might be for people with also sight loss and maybe other conditions that struggle to understand words. So people living with dementia also benefit from this too. So thank you. That's great.
Or parents who are trying to manage entry of large numbers of children to an attraction and are not necessarily listening to the information that's being given to them. So it has a sort of multiple purpose in that sense as well.
Brilliant. So thank you for sharing that, Joe. That's great. So it helped more people than originally targeted. So that's great. So circular economy, let me see. Account with accessible and route the whole new hub out with access information. So could you explain that a bit more, Sarah?
Hi, yeah, can you hear me?
I got the captions in front, so yeah.
Yeah, sorry, my video's not working properly. So I've started working part-time working with Malton and Norton Circular Economy Hub, which is going through a lot of changes at the moment. And we're looking at new premises. So I'm not sure if you're familiar with Accessible, but it's a national organisation working with Visit Britain, which is an online platform for where their accessibility guides are now placed. So it's very interactive. You can go through put lots of different information on there. So my plan with the new hub is to go through all the dimensions of the rooms and the level of the flooring, etc., and have that information with images in a prominent place and on Accessible, so that that information is available to people who are looking to come shopping and visit the hub, but also on a bigger scale, I'd like to get Malton and Norton more involved and get more shops and restaurants and cafes promoted on there as well, so that they've got that information for visitors, so that they can make their own decisions when visiting the area on what, you know, premises and attractions suit their access needs. So it's in the early stages, and I'm only in my 4th week at the hub, but there's lots of things to do. But then what I will do, because we have a lot of volunteers, is also then train the team, you know, if we get any questions, then they know where the information is as well. So that's the idea.
Brilliant. That sounds really, really good. And absolutely, so having mapping of a venue before people arrive is so helpful. And it's something I've been working with hotels in terms of making sure people can see the plan before they arrive.
Yeah, Accessible's a lot more user friendly, because the other website that Visit Britain used was it was a hosting website, whereas this is, you know, Malton and Norton, well, North Yorkshire, in fact, because I used to work at council, they have their own platform on there, and then it drills down into different towns. So it's in its early stages, I'd say, but it's definitely leading the way with being able to showcase a town or an area with searchable facilities on the site to find the information, which is a lot more user friendly than it ever was before.
That sounds brilliant. I'm really looking forward to seeing this rolled out, because this sounds much needed and it would be really useful in lots of different cities. So thank you for sharing.
Absolutely. Yeah, it's national, so it's going in the right direction. Yeah.
Brilliant. Okay, so keep me in touch on that one, because I look forward to see more of that. Yes, definitely. So thank you. So you see, from this discussion, we've learned from each other different tools and different things that people are working on. So it's brilliant that these have been shared. So thank you. And have we got any other ones? No, that's fine. Okay, so thank you for sharing all those different things that we can do to make things more accessible. And when we do that, we are actually going to improve the economy, because we're going to move into the purple pound fairly soon. We're going to make it more accessible for more customers, and not only the customers who are disabled, but also their family and friends. So we'll go on to the next slide now. So thank you very much for that discussion. That's great. Okay, so we're going to look at the legal part now very briefly. And as I say, this is brief today because this is an introduction. So as well as being an incentive for businesses to engage with disabled customers and employees, there's also a legal reason why you need to do that, and that's the Equality Act. Now, the Equality Act doesn't just cover disability, it covers age, religion, belief. It's all listed there: sex, gender reassignment, pregnancy, maternity, civil partnership or marriage, race, etc. So, and that what it actually means in practice is that none of the protected characteristics can be discriminated in any way. And if you do discriminate in any way towards any of the different protected characteristics, which many of us will have multiple identities, you're liable to unlimited fine and possibly loss of a license in some cases. So a restaurant refuse entry, they could lose their license. Okay. So next slide. So reasonable adjustments to make your services accessible. So I went to a venue not that long ago where they said they're fully accessible, and it was great. I thought, great, they have a ramp to get in, and then they can get into the building. But once they were in, there was nothing in place for them to be able to interact. There was not enough space for the wheelchair to move around. The toilets were not the door was not wide enough. So accessibility isn't just about getting into the building. Now, you need to be accessible in every way. So inclusion, this is where the difference between accessibility and inclusion. Accessibility is removing the barriers to enable people to participate. Inclusion is about creating that sense of belonging. If you let somebody into the building and they can't participate, they're not going to get a sense of belonging because you have excluded them from participating. The same if I came into a building and there was no facility for me to be able to hear. I might be able to get into the building, but I'm not going to be able to participate. So that sense of belonging had gone. Okay, so it mustn't be an afterthought. So the reasonable adjustment are small things, are things that you need to do to put in place to enable people to participate fully. And this is employment and this is in customers. Okay. So in practice for customer services in hospitality, it means listening and responding to your customers. So if some customers are not coming in, or they're coming in but not being able to participate, you need to find out what would help. So good customer service is about listening and responding to customers, and then taking it up to actually do something about it. Okay, removing those barriers. And if you do have a problem, so for example, I know somebody who went to a theatre and the loop was not working. Do be really explain to that person, I'm really sorry, and give them a free ticket, because otherwise they will never come back. 70% of customers who have a bad experience will not come back. So you need to go out of your way to give them an incentive to come back. And that example I just shared with you at the theatre, that person did go back, thought, well, at least they apologise, and then they're giving me another chance to test it out. Okay, so removing barriers to enable people to access the service. Next slide, please. Okay, one of the things that very, very common when I'm working with businesses, people say, oh, this is so expensive to make adaptation. Now, I changed the word cost to investment, because I've been able to convince businesses that the more you invest, the more you get back. So start with the small changes that you can make, and you'll see those changes. And then plan and prioritize the ones that cost a little bit more. And eventually you will be able to meet all of them. If you show your plan, and if you know that you've got a customer who will need certain things sooner than later, put those bigger changes in earlier. But as I say, it's an investment. Investment, and this fits in really well with the Purple Pound. Investment is, so for example, in UK at the moment, £274 billion has been lost to the UK economy because of a lack of access. Now, to illustrate this as an example, I myself have a profound hearing loss, and I can't go to the cinema without captioned performance. Now, captions, certainly where I live, is very rare, and it's at the time when I'm working, so I don't go, and nor do my family and friends. So, and based on the population of where I live, of 33,000 who are deaf and hard of hearing, even if 10% of that deaf and hard of hearing community went to a cinema 4 times a year, let's say, as an average, and spend on average £40–50, we're talking about a lost revenue of £1 million for cinema. That's just one example of how quickly you're losing revenue when you exclude people. Now, captions, as it happened, is actually something that many people nowadays actually like. Because of social media, you've been used to watching it on your phones or social media. Also, people with auditory processing disorder benefit from caption. People with English as a second language benefit from caption, so on. So what I'm saying is caption benefits a much wider group of people. So my argument would be to cinema, you need to put more caption performances. Even if it's just 50%, that's better than the current one of 1%. It really is very, very, very limited. Okay. Yes, absolutely right, David. That's a really good point. So don't implement an adaptation that don't stand out and make the recipient conscious of the adaptation. Yeah, the loop put right in front of the person now. That's not very discreet, is it? So many of these things are inclusive of a lot of people. So captions is just an example of where a business can create extra revenue. Okay, so we're going to go on to the next slide. So I've already talked about this, and also just to go, just on the previous slide, just to mention that involve people in your community to feedback, because it's so easy not to see what the barriers are. So, for example, I worked in a care home industry for a number of years, and when I walked into a building, I noticed the acoustics was really bad, and it was too dark, and the seating wasn't appropriate for people to be able to hear properly. Now, 71% of the residents in that care home had a hearing loss. So working with disabled people, you're actually going to see things that other people don't see. So as a result of that experience, I was able to implement things that quickly made the acoustics better for people who had a hearing loss. So this is where working with different people, and I can't say I represent everybody in the disabled community because we're all different. But what I'm saying is work with as many different people as possible to get an insight into all the different barriers that you may have and remove them as best you can quickly. Okay, I've already talked about the deaf-friendly cafe. Awareness, and we've already covered that, so we can move on to the next slide. Okay, so I've talked about, I'm going to talk about good practice now. This is a really nice example of a company that is in Belgium. It's a big company called Trap, and they deliberately employ disabled people. In fact, they recruited people with learning disabilities, and their profits went up significantly. But not only that, they had the workforce environment change so positively that people didn't want to leave. People felt safer to talk about their own hidden disabilities, going back to what I talked at the beginning, psychological safety. Recruiting someone, they saw that their employer were interested in working with disabled people, so they felt safer to be able to talk about their own. And so they became much more supportive of each other. And as a result of that, absenteeism gone down and staff turnover gone down significantly. And as I say, profits increased. I think it was 35% increase in profits in the first year once they recruited people living with learning disability. And customers were really, really pleased to see visually that they were recruiting disabled people. But also, what was really interesting was that customer services found that adults with learning disabilities were often more sympathetic, empathetic. They were able to defuse when a customer got angry, because they were so used to themselves being excluded that they had better skills than many of their colleagues in diffusing tension. So it just shows some of the skills that are being missed when we don't recruit and work with disabled people. So this is lovely research. I would recommend you follow Louisa Alamy and Freek, I should say, it's a Dutch name, Freek Vermeulen. They have done extensive studies on a number of organisations that have deliberately worked with more disabled people and have created policies, robust policy, to be able to support people in a better way, and which benefits everybody. Because if anybody acquires a disability during their employment, they're more likely to come forward and share that and stay in employment in the environments that have been shared by their research. Okay, so let's move on to the next slide. Okay, so accessibility. So I talked about inclusion. I just want to make sure we understand what accessibility actually means. So it's about offering everybody a warm welcome and equitable experience. Now, equitable is a key word that is important for you to understand. So it's not about providing equal access, because actually, for many people, we need to remove barriers in order to create an equitable experience. So, for example, as I mentioned earlier, for me, having caption enables me to be able to hear and listen to a film. That is equitable. Where equal, you just provide the film, no changes have been made. I still can see the cinema, but I can't hear it. So it's doing the adaptation to make it equitable to those relevant different groups, or for someone who has sight loss, audio description, etc. Removing physical barriers, so educating and supporting staff on challenging assumption and perception is something that we do in disability awareness, and is something that is really powerful when you actually explore your own prejudices and actually change your behavior toward working with disabled people and serving disabled people as customers. Removing physical barriers, so it's not just about ramps. It's also about making sure that when people in a restaurant, for example, all the bars might be a bit high up, having something lower down so they don't feel they have to look up the whole time and somebody looking down. So trying to make it a more comfortable environment for a range of people of different heights, but also people maybe in a wheelchair who can't access. It'd be nice for them to be able to order, not have to rely on somebody else to order their drinks. So physical barriers are important and can really show customers that you're serious about inclusion and accessibility. Making service adjustments to a wider group of people. So I've already shared many examples of that. So just think about making adjustments which actually impact on a wide range of people. Most changes, as I said here, we've got ramps. Ramp here benefits not only people in a wheelchair, it benefits people who maybe a family who push chairs, but also benefits people in a suitcase, heavy suitcases. When you're traveling, you really notice where those steps are. You notice where the ramps are. So when I had a trip not too long ago in Canada, and we went through London, and some of the tube stations are so inaccessible with a heavy suitcase. And that really highlighted to me how many tube stations in London are not accessible for people with a wheelchair. And so they often have to take taxis, which is really unfair because they have an added cost to their journey. Okay, next slide. Okay, so to get started on your inclusion journey, one of the things I encourage all businesses is to get a checklist. Now, a checklist doesn't solve everything, but it makes you aware of some of the things that you need to start looking out for. Now, Visit Britain and Visit England have actually done some really good checklists, and depending on where you work, which ones are relevant. So, for example, I got here the food and beverages one. They have 20 top tips on things that you can do to make your services more inclusive. Now, they are very simplified. It's to get you started. And as I mentioned earlier, if you use this in conjunction with actually involving your local disabled community, then you're more likely to be able to see further details. So, for example, they mentioned about ordering food on a phone text for people who are deaf. Now, that might work for some people, but it's not for everybody. I don't, for example, use text-based. So do be careful you don't fall into that trap. Oh, they recommend this, that solves everything. That is a suggestion. There will be other suggestions that work too. But it's a really good way of getting you started. And I will share after this training a very basic checklist that I created a while ago. And then also the 20 here. But I would encourage you to see the website, and so to choose which one is relevant to you. I mean, I'm happy to explore that further in the training. If you like, you can bring it into a training, and then I can go through that with more detail with you. Okay. So, yeah, I will mention that. So if we go on to the next slide, that'd be great. Thank you, Joseph. Okay. So just inclusion is a journey, and we need to learn from your mistakes. We all make mistakes all the time. As long as we can't continuously learning, that's fine. 24% of the population are disabled, and this could be you at any time. This is just a reminder that, you think, oh, it doesn't apply to you. It can and will do for some people. Some disabilities are temporary, so many of us may have experienced a broken leg or something, temporarily out of action, and others are more permanent. 78% are acquired later in life, And accessibility, I would say, is everybody's responsibility. It's not just one person. So I've been to businesses to say, oh, we've got one person. In fact, no, everyone needs to know what is involved. It's all very well having one person who may have overall responsibility, but it is overall responsibility in making sure that the staff understand about accessibility. But we do need everybody to have experience and understanding of what is required for people to become more inclusive. Okay, so the next slide. So this is a summary. We're coming towards the end now, and there'll be plenty of time for questions. So inclusion is a journey. Learn from your mistakes. Start with a quick win. So noise is just a quick win. Now, noise, I know for some businesses, and I do know the research, for example, bars, apparently noise encourages you to drink more. So it's that balance. And so I just sort of say that, yes, you may need noise to get people into the building, but what if a customer turn it off or turn it down. So I suggest using a quick checklist I've already mentioned. All of this I've already covered. So I think we'll move on to the sort of questions, if you like. So if you would like to put questions in the chat box. And yes, that's thank you, Joseph, for putting the next slide. That reminds me. So the training is in the new year. We think we'll be doing it in Selby, Northallerton, Harrogate, but that may change. So please do keep an eye out. And if you're in a particular location you would like it near you, let us know, because we might be able to find a venue. So Joseph and I haven't finalised the details on that yet. So it depends on the people coming back to us.
Yeah.
We also, the workshops are up to 3 hours. They will be very practical. So I would really encourage you to fill in the feedback form, because I want to be able to tailor the training to all the different participants. All the training I do in my own business are bespoke, so it won't be the same each of the 3 training that I do in the new year. So please do share what you would like to see in that training, because I'll make sure I respond to that. We will be exploring definitely the more details of the Purple Pound, correct language, dangers of assumption, models of disability. We didn't touch on that today, the social model of disability, effective communication techniques, other small actions that can make big changes, and more. Now, there is no cost to this session, because these are sponsored by our funded North Grove and York North Grove Hub, or one of them. So these are free for people to attend. So any further questions on that? And they are targeted mainly for hospitality, but depending on the level of interest, I think we'll be open out to wider.
I think in discussions we'd kind of said customer facing businesses primarily, so kind of hospitality comes to mind, but it's applicable for retail and it's applicable to staff, so it should be quite kind of far ranging. And as you say, we'll shape it in response to your feedback. So if you do want to fill in on that form and say the wheres and the whens and the whats, we can take that into account. So yeah, please give your feedback and we'll shape it accordingly.
Okay, so thank you very much for attending. And if you spread the word, that's really great. And any feedback, much appreciated, good and bad, just so that I know what sort of thing to put in. Okay, any questions that we've got for this? Thank you, Sarah.
Yeah, and as I said up top, I'll share the slide deck and the video out. So if you think that was helpful and you can think of anybody else who might like to watch the recording to catch up, please do share that out. And I think you mentioned a couple of other resources as well, Rachel. So if there's anything you want to send to me, and I'll make sure that goes out to everybody as well.
Okay.
Great stuff. I think we've got a question. Yeah. David's asking, how do you begin a survey with your clients to ask them what changes would help?
How do you begin a survey? Well, that's a really good question. Depending where you are, so that will vary. So where is this coming from, David? Is this? So
we're not hospitality at all. So, but we support clients with healthcare in their own homes. So we send trainers out to them all over the UK to support them. They might have a tracheostomy, they might have a catheter, and we make sure that their team know how to look after them in their own home. So our trainers are already quite well adept at understanding a disability to the very extreme. But that's not to, that's, you know, we need to make sure we don't forget about the lesser disabilities, and, you know, like the hard of hearings, the ones that aren't very good with visual information on, you know, if they got given a 10-page PDF that they needed to read as part of their learning, we need to make sure that they feel like they have a voice, that they can say, I'm struggling here. And so I want to know ways that they can come back to us. Do we send out a survey to our clients and say, where do you need help? Where can we support you without you feeling like you're conscious, that you feel the ability to tell us that?
Okay. So so in that situation, I would so if you're doing it on an annual basis, or is this something a continuous survey?
We could do it on an annual. We would probably do a one-off annual. We always do an annual review anyway with our clients to see how we're doing. But one side that we kind of want to, as technology is getting more and more advanced, and we're advancing in our technologies, we want to make sure that we don't leave clients behind with client access portals and different ways of accessing their own information. So we want to make sure in the future, when they're interacting with us as a company, we don't feel like we're leaving them behind, and making sure that everyone's in the same boat.
Okay. So I mean, I certainly could help with that, but I think I would need to look at how your business model works and to show you how what would be the best way approach. But personally, if you're working with clients on a daily basis, I think it's more about making sure that they feel that there's mechanism feedback at any point, because needs are going to change. So you know, at one point they might not need something, then the next they will need something else. So it's a bit that needs to be open. In terms of an annual survey, I think it's really good to give them an opportunity to come up with added technology and things that are changing. So, for example, in the deaf and hearing community, we have a lot of technologies that changed rapidly in the last year. Mainstream technology has changed more rapidly than, I would say, the deaf technology. Mainstream technology that we can use that benefits us. So if I was a client of yours, I would say, oh, these are the different gadgets I could use, or different tools that you can use with different clients. So for example, in my case, there's one really lovely one. It's a phone, the smartphone. The smartphone has so many accessible tools on there, not just for deaf people, but people with dyslexia, people who have sight loss, etc. Actually making sure that your staff are aware of that and the clients are aware of that. That is in itself, you know, of benefit to a lot of people. Okay, does that answer the question? Yeah. Okay,
That does. Thank you.
okay, any other questions?
I think we're not.
Sarah and Joe, yeah. Okay, so if there's no further question, as Joseph will be following up with the slides and the webinar recording, if you do have any further questions, do feel free to get in touch with us, including on how to get into the workshop. Do spread the word with anyone you know who you think would benefit from the workshop, because we would like to have at least, I think the optimum number is 12. We don't want to be a big group, because I want it to be an interactive session, but up to 16 is fine. So as many people as you know who would benefit would be great. So we'll spread it out in 3 different locations across North Yorkshire for ease of access. It will be near public transport. Is one of the criteria that I know a lot of customers I work with say. So we will make sure it's near public transport of some sort. Okay, and plenty of parking, hopefully.
Sorry, I just had a quick question. I wasn't sure how to put my hand up. I'm not too familiar with this platform, but just a quick one. So I know you've got certain workshops that you're going to deliver, but if there was 12 from a business or a town, would you be open to putting on a specific workshop for those?
I think as it stands, we've assigned budget to deliver 3 of them. I was very keen to do it in Selby and Northallerton because I've got some colleagues who really wanted it there. The third one's fairly up in the air.
Okay.
So it might be that the best way to do that would be if you could give me the details of that. Maybe we can plan one that's largely filled by one business, so a lot of individuals from one business, but open to some others as well. So maybe
Yeah.
that just, you know, if we know there's going to be a lot of demand in one place, we could maybe use that as the evidence base for where we do the third in the first place. That maybe they align quite nicely.
Okay, yeah, all
Yeah.
right, leave it with me. That's good to know. So I guess there's only so much funding available for the 3 then, is
It might be that we could do more in the future, but that's kind of what we'd planned for this year's program. But yeah, obviously we're keen to fill them, and Rachel's keen to have some good numbers in the room. So if you've got something in mind, please do get in touch. There's the support at inbox there, or you should be able to find my information on the website, or I can send you an email if you like.
Yeah, great. No, I've taken a screenshot of this. I've got all the details. That's great. I'll
Great
be-
stuff. Yeah, yeah. Get in touch, and maybe we can kind of plan the third one to align with who you've got in mind there.
Yeah. All right. Thank you.
Great stuff.
Okay. So, and also we will be sending information in advance so that people can share their access needs. So if you know of customers who would benefit from the workshop, but also have access needs themselves, there will be a questionnaire sent out, and it can be sent in different formats. So please do let us know if that's needed, and we'll send it out at least 2 to 3 weeks in advance so that we can put in place, whether it be BSO, interpreter, or Macinton, whatever it is. Okay. So please let us know.
Great stuff. Well, yeah, thank you very much, Rachel. That's been really informative, a really great start, and yeah, we'll have more time to dive in depth in the physical sessions. And thank you for everybody for coming and for getting engaged with that. I'm happy to wrap up there. So if you do have any further questions, get in touch with us through the support inbox, the address that the joining link came from, and that'll come back to me, and we can work from there. But yeah, thank you again, everybody, for coming, and have a good day. Take care, everybody.
Thank you. Thank you for coming.
Bye now.
Okay then. Bye.